Hello, Dr. Dilip Gude here, physician, Samaj Guda, Yashoda Hospital. Let us discuss about liver disease and its symptoms. So, how will a liver diseased patient manifest? With what kinds of symptoms or complaints is he going to come? Now, fortunately or unfortunately, basically, liver is a very good organ with a regenerative capacity of up to 80%. So, if there is an ongoing onslaught or a damage that is going on for a long period of time, liver can actually sustain it. So, until there is 80% of damage, your liver can actually keep regenerating and continue the detoxifying process that it does in the body. So, for example, alcohol keeps on damaging the liver over a long period of time. Now, if alcohol is not taken in moderation, or if it is taken, say, beyond 60 to 80 grams of alcohol every day, then it definitely causes a condition called alcoholic liver disease, which, if unchecked, will go on to become chronic liver disease. Or, in fact, later on, it becomes cirrhotic liver, cirrhosis of liver, where liver gets shrunk, and the function of liver is actually slowly, it's going to get lost. And then again, there are two types there. You have compensated liver disease and then decompensated liver disease. Now, cirrhotic liver eventually may lead to HCC, that is a condition called hepatocellular carcinoma, or in other words, cancer, liver cancer. So it is basically a spectrum. People who are not drinking alcohol at all, for example, even they have a condition. If they have, say, hepatitis B or hepatitis C, or if they are on some kind of drugs that can affect the liver, then over a period of time they develop this, fulminant hepatic liver failure, which can lead to cirrhosis, or even sometimes in some patients HCC, that is hepatocellular carcinoma. So basically, when there is a liver dysfunction going on, you may not know it at all unless you do a test, that is liver function test, or GGT test, gamma glutamyl transferase. So in fact, the GGT is a specific, it reflects the alcoholic liver disease related damage. So when someone has been drinking for a long period of time, but he may not have any symptoms, then the only way you can find out or you can establish that there is some degree of liver damage going on, GGT is a very important test. In fact, SGPT, SGOT, these are two other parts of the liver function test panel that can help you identify any degree of liver damage. So once you understand there is increased GGT, increased SGPT or SGOT, then it is really imperative that you cut down or stop alcohol intake completely, and make sure you do not have any hepatitis B or hepatitis C, and you are not on any hepatotoxic medicines. Like, for example, simple paracetamol can cause liver damage if taken in more than the recommended dosage. For example, in a patient with say malaria. Malaria, as we all know, definitely affects the liver, especially severe types of malaria can affect the liver. So someone who has fever, who's taking tablet like paracetamol, say 3 or 4 times a day, their liver can get affected. In fact, sometimes to a fulminant degree, meaning their liver can be so much damaged that they may require liver transplantation as well. So it is really important for you to understand what kind of medicines you're on, how much liver damage has been going on. Are you on very mild doses of, if you're taking less amounts of alcohol or not? Are you on any kinds of viral hepatitis? Did you have viral hepatitis before, or are you having any ongoing viral hepatitis or not? So it is really important to discuss with your gastroenterologist or physician colleague, and then find out if there is any liver damage that's going on, and if there is a evidence or a focus that you can find out on blood tests, then it is very, very important for you to stop the offending drug or an agent like alcohol, and then make sure you're on hepatoprotective or hepatoregenerative medicines, which can help you to regenerate the liver to some extent. So it is really important that you should not self-medicate, especially if you have fever and all. Taking 3 or 4 tablets of Dolo per day may actually push you into sometimes irreversible liver damage. Thank you.